We're going to bring back all of our previous presenters at this point in time, folks. And again, just a reminder to everybody that we'll be sending out a full deck of all of these slides to you this afternoon. So you're going to be able to have access to all of these resources and all of these slides to refer to. I'd like to, if I could, start some of these questions that came through, Katie, during your presentation that we just had here. Can you say a little bit more about the relationships between the health centers? Somebody was asking, are they really insurance blind as such? What can you add in terms of that question?
Yeah, so most student health centers our goal is to provide no-cost care to clients. Specifically, our Multnomah counties are, yes, we are insurance blind, as you would say, which means that while we can bill insurance, we offer no cost for any of our services to any client. We have mechanisms we have a couple different programs, such as the reproductive health program here in Oregon, where we can actually enroll clients for reproductive health services and be reimbursed for that. But that is correct. We are, I guess I've never heard the term insurance blind, but I like it. But yes, we are insurance blind. We take all insurances, and we do have contracts with most major insurance companies, actually including Kaiser, in the community. So we certainly can bill for all of those, but we do not need that. So we have no way to collect money, and we have no intention to start.
Great. We've added a new phrase to our lexicon here today, the insurance blind. There's, many of us feel that way on a regular basis. So even when we're at the payer, but, and then here's another question that came in just recently here. Katie, when you say prescribe for Narcan, the question was, does it mean that it has to come from a prescriber, or does it mean that it's just tracked and documented? This person says that they're aware that Narcan is available elsewhere without any interaction with a provider. And I think the question was, is it something that's specific to working in a school?
That's a really good question. I'm really glad you asked it. The reason why our Narcan dispensing are attached to a prescription is because of the purchasing program that we used, which is a federal purchasing program, the 340B program, which requires that the prescription be attached to a provider visit. If we were to use a different purchasing program, such as an MCAP or a direct purchase from manufacturer, those would not need to be necessarily attached to that interaction with a provider. Certainly, Narcan does not require a prescription. We have gone ahead and continued this model and this practice, partly because they're sitting in front of us when we're screening them, so we're already in the visit, and so we just can go ahead and give that prescription. Future state, could we potentially look at just dispensing Narcan without a prescription? Absolutely. We'd have to work around what that purchasing program would look like and if it would be cost effective for us. But no, we do not. Narcan does not need to be attached to a prescription itself with a provider. It can be done with that. This just happens to be our particular model. And I will say that because of the population, because of the youth population, we do really appreciate that the time that we have to educate the youth on what signs of overdose and how to correctly administer that. So we kind of consider it to be sort of a win-win for us because they're sitting right in front of us, and we can not only hand to them that dose of Narcan, that prescription, which they're actually getting the physical prescription, getting the dose themselves that day, but also those education practices.
Excellent. Super helpful. That context is huge. It's huge on there. This question, I would throw it open to anybody to weigh in on. I think we see in local media here in Oregon, right? There's a tremendous awareness of the issues with fentanyl, right? And especially in terms of dire overdose situations. I mean, do we feel in general that the youth population has as much awareness of what's going on in terms of the lethality of that? Are they more aware than the typical mom and dad? watching the news? What's your take on just their awareness of how, extreme these circumstances are? Anybody who wants to take that one. Just what are you seeing?
Well, I'll jump in just because I know I sit on one specific end of a spectrum. The students that I work with are absolutely aware. The majority of them they all carry Narcan. A majority of them have been in positions to administer naloxone to individuals who need it. And so the conversations that I sit in on a daily basis with the students I work in is that there's absolutely an awareness and an understanding, both for the risk, but also where to access and engage in use readily. So there's a lot of space for harm reduction and safety measures to be put into place. And I'd be curious from Katie and Dr. Hilde, as you see a broader swatch of individuals on a daily basis, to speak to that further.
I would say it's such a wide variation. We have kids who are very aware and have a lot of knowledge about fentanyl, how to avoid it, how to handle overdose, carry Narcan, are very aware of that. And then we see a lot of students who have absolutely no idea and don't know what Narcan is, don't know what fentanyl is, and that's sort of one of the things that we really want to make sure that we're doing is targeting both youth who are aware and who are unaware, so that they can be cognizant of the dangers out there and how to avoid potential overdoses.
Yeah, this is Anna, and I would echo what Katie said. I think there's a really wide variation. What I will say is that I have seen with several youth that I've worked with that kind of optimistic bias where they are using, and they they know other people have overdosed, but they don't think it's going to happen to them.
Then you add to, this, whatever a person's level of awareness, and especially if somebody's thinking that, okay, I'm 15, I'm immortal, nothing's ever going to happen to me. I mean, I think we all sort of had that, that bias and that slant in our youth, right? But the whole idea that so often there can be so many counterfeit drugs that are out there that are labeled as one thing, like during the slide that Dr. Hilde presented in the early part of the presentation, where it looks like one thing, but it's completely, its contents are 100% different. You don't know what you're getting. So there's a huge risk of, almost like, the Russian roulette factor almost with these things. And somebody can think that they're innocently experimenting with something, but there's a whole nother level of, of risk that's just impossible to even know about. Which is just, disturbing.
I would say, and I think it's really important, I think that even though adolescents have these challenges and vulnerabilities, they're incredibly intelligent, and thoughtful. And when given the information, I find that many can make really good choices. With Stacey, engaging in those conversations with them, providing them with accurate information. And so kind of what all of us have brought there, these programs that Katie is developing, it's about giving our adolescents options and information so they can make the best choices. And I think most of them do when they get that information.
I would add, yeah, I absolutely agree. And one of the things that I find to be a real bright spot in this is the level of compassion and concern that youth have for their peers, and that when we're talking to youth and offering them Narcan, oftentimes while they don't think that they will be impacted and that it won't happen to them, they are often very aware of their potential role in helping their peers and what would happen if their peers overdosed. And that's something that they show a lot of concern for. And that's a really lovely part of it is that they have something that they can do that can potentially help their friends out. And they show a lot of interest in being a part of that.
Yeah, and it's just again, I just think it's something that I think our audience is the impression I get is from what you were saying, Katie, about the way you define the school-based health centers as being like this, the best kept secret that you wish wasn't a secret, right? When you look at that map across the state, because that's one of the things about, you know, CareOregon and MedZed is we have folks joining us not just from Multnomah County, but from all over the state, right? From you know, especially in like the southern part of the state, you know, Jackson County, Jackson Care Connect, and Columbia Pacific on the northern Oregon coast. We have a lot of people there who may not be aware that there can be resources like that are in proximity that they can take advantage of. So I think it's just really important that this gets as much exposure as possible. So I'm checking to see if we have any other questions that are coming in here. Again, to our audience who's still with us, we have a couple more minutes that we're still able to answer questions. So by all means, don't be shy. There is no such thing as a bad question, as we like to say, right? But so go ahead and feel free to put those out there. I'll ask also in the time being while we're going through here, is from any of your perspectives, what do you see coming down the road in the months to come here that you might perceive as like emerging trends or things that you are most concerned about that you see starting to emerge? Is there anything like that that's on your respective radars that you'd like us to sort of be keeping an eye out for? I know we've heard we had a session on MedZed about a little less than a year ago that was kind of focused specifically on the fentanyl crisis. And one of the things that our friends at Central City Concern had mentioned was the emergence of xylazine as a drug that was starting to make its way into the population, as you know, kind of super alarming in terms of the impact it had. Has there been much of that you've encountered?
We have just started we've been testing for it at Great Circle Recovery, and but primarily those are adult populations. And it is starting to come into the fentanyl powder. And so, yes, I think it over time, it's going to continue to be present more and more often, I think.
Something to keep in mind, but yeah, definitely troublesome stuff, to be sure. And I feel like we're not getting as many questions come through here, and so our audience may be digesting all the information and considering things. I wanted to just give all of our presenters, well, a couple things. First of all, our heartfelt thanks for being so generous with your time and expertise, and being willing to engage like this and provide so much wonderful information. One of the things that from one session to the other that the MedZed audience really appreciates is they love being given like directive information. Like if there's something that they can go back to their clinics and start doing right away. So I wanted to give everybody an opportunity amongst our presenters here today. If you had a wish list item of something that you wished folks in primary care would just start doing today, a simple act that you think would make a lot of difference, that you would just wish people would do or stop doing, if it's the more appropriate. I just wanted to give you a chance to speak to that. Dr. Hilde, do you have anything on your perspective that you wish you were seeing more of?
I think the screening, right? I think if we get everybody to be doing screenings, and we can start to really see who is using and who needs more assistance. And then I think also as people become more and more comfortable learning about medication-assisted treatment, we just need more providers that are willing to be prescribing medications in the community.
Stacey, thoughts? What do you think? Is there something you from your perspective there that you wish you saw happening more?
Yeah, like out of that primary clinic space, we know that our young people show up pretty consistently in medical offices and in schools. And so wherever those screenings can happen, to just have an awareness of what's going on for anyone, and really personalizing it and from the broad broad information that can come out of screenings, and so much of that it can come out of those MI skills. And so if you haven't completed any MI trainings, they're really easily accessible from so many different spaces, online resources, often free, quick 1 hour little tutorials. So I'll make sure I add additional information to send out to the group.
Great. Great. And we have a preliminary one on from MedZed that we've got videos on too that have been kind of fun and helpful to just make it accessible. And then we talked a little bit about a question that came as springboarded as well, just from you, Stacey, here. We were talking about the different areas, and especially folks who receive CareOregon in more rural areas, right? Like on the coast, for example. I think sometimes we get the feeling that anecdotally or not, that there's a lot more substance use in rural environments than there is in urban environments. I don't know if that's a myth or if that's something that we tangibly know is beyond anecdotal, but the sense among people is that that's the case. And do you see a future, this question's coming from the northern coast, in which some of our members would have access to something more akin to Harmony School, where there could be more peer programs or youth SUD programs that could be available in rural areas? What have you seen towards that in terms of like growth or availability?
That's a great question. And I think what we do know is we just have more treatment desert or resource deserts in our rural parts of our state. And one of the benefits that the pandemic brought us is an increase in virtual resources, so that there may be access, if you're physically rurally located, that you can tap into some of the resources that our more urban areas offer. Some exciting news with the recovery high schools is that our legislation passed this last year, House Bill 2767, which is increasing recovery high schools across our state, upwards of 9 new schools that will take some time to roll out. We know that the Tri-County area does get a wealth of resources. We have 2 recovery high schools right now. There's work towards a 3rd one opening up in Lane County, and with the hope of another 6 opening up over time. I know that there's work at the state level, OHA, to have peer support models, Prime Plus peers out of healthcare clinics. And so again, where can you tap into those places that youth show up, doctor's office, schools, and ask them as content experts in their communities as what resources you can connect students to, young people.
Fantastic. I love hearing that there's emerging opportunities for that, thanks to bills and things like that. But and then I want to go back, another question for you, Katie. Someone is asking, with fentanyl being on the rise as it is, have the school-based health centers explored keeping fentanyl test strips available for youth?
We have, yeah. When we were first starting all of this, we met with our public health partners who do a lot of dissemination of fentanyl test strips and do a lot of that education, and asked them their thoughts on it. And at that time, they did not recommend that as an appropriate intervention for our population, given the amount of training that goes into it, and the potential for false negatives around students who aren't, or people who aren't using them consistently. They felt like there was an increased risk. That being said, I think it is definitely worth having ongoing conversations about, and making sure that still isn't recommended. That was our public health partners at the time, and as things change, I think it's totally appropriate to continue having those conversations. But at that time, that was the recommendation to us, was not to use them. But yeah, I think it's worth continuing to explore.
Thank you, thank you. And then I think I have one last question here. No, I think we actually have managed to get everybody's questions addressed, and I know folks are having to duck out here at the bottom of the hour. So I just want to again take a moment to just express from us here at CareOregon to all of our presenters here today, to Katie, to Stacey, to Dr. Hilde, how much we appreciate your work on this and everything, not just this presentation, but on everything that you are doing on an ongoing basis that makes such an incredible difference for people, and for giving us so much optimism and such a strong reminder that the youth of today are wildly intelligent and way smarter than we ever were, I think, and very resilient, and they just need us to be able to find ways to communicate that with them in an effective way that doesn't hide away from things and that sees them where they are. So I think it's wonderful. We want to extend the invitation to all of our presenters. If you feel at some point that there is new movement happening that you want folks in our audience to know about, we would love to do another revisit of this topic with you and do a chapter 2 at some point down the road. So whenever the urge may strike, the door is always open for us, and we're really love to be able to continue exploring this because it's incredibly important. So thank you.